Good afternoon, everybody. Thanks for joining us for a emergency session of our 2021 OSHA webinar series. This is, of course, in response to the most recent action on the COVID-19 front, OSHA issuing its COVID-19 vaccination testing and face coverings emergency temporary standard late last week. And we're delighted to join you today to talk about what's in the rule, what's not in the rule, who's covered by the rule, how it's intended to operate, and of course, the latest and greatest on the legal challenges to the rule and what that might mean for the future of the emergency temporary standard. Do some real quick introductions. The first faceless voice you're hearing right now is Eric Kahn. I'm one of the founding partners at Kahn Maciel Carey, and I chair the firm's national OSHA Workplace Safety Practice Group. I've practiced for a little more than 20 years now, essentially exclusively in the field of workplace safety and health law, with the first decade or so alongside the former first general counsel of the OSHA Review Commission. My practice is full service, soup to nuts, workplace safety and health law. We help with inspections, investigations, and enforcement actions involving OSHA and the state OSHA plans and any of the other alphabet soup of regulatory agencies that get involved in workplace safety and health legal issues. We also work proactively to help employers develop compliant plans and programs and to audit programs and procedures and really the full range of OSHA related litigation as well. I've been, over the last 2 years, been fortunate to serve as the OSHA co-chair of my firm's COVID-19 task force. So in addition to being what I thought was an incredibly specialized type of lawyer focused on OSHA law, for the last 2 years, we've been even more focused. I've been a COVID-19 OSHA lawyer. I'm very pleased to be joined today by a couple of my colleagues who I'll let introduce themselves right now.
Good afternoon, everyone. It's good to join you all. We don't want to take a lot of time introducing ourselves, but let me suffice it to say that I've been practicing in this area for a very long time. As Eric said, our practice has been very broad historically, but the last couple of years, I'm describing myself as a COVID lawyer. So we have been helping our clients through this pandemic, helping them develop policies, helping them deal with the sensitive workplace issues that they face as an employer dealing with workers who have vaccine resistance. We have been looking at all of the requirements that not only federal OSHA, but all the myriad of states have established associated with the full panoply of requirements related to COVID prevention, infection control, hygiene, out of work standards, et cetera. So we have all that. And now on top of all that, we've got this new ETS related to vaccine and testing. So we are happy to talk to you all today about what that means for your workplace. And let me turn over the mic to Lindsay DeSalvo, our co-presenter and one of our co-chairs of our COVID ETS workplace task force.
Thanks, Kate. Good afternoon, everyone. Like Kate said, my name is Lindsay DeSalvo, and I'm an associate in both the firm's OSHA and labor and employment practices, which has been a very interesting position to be in over the last couple of years. We have been dealing with a lot of different issues that have arisen related to COVID-19 on both the safety and health side as well as the employment side. And we've definitely seen this with the ETS even as well. The ETS is a standard that has been put out by OSHA, but definitely has implications beyond just the safety and health realm. And we'll talk a little bit about that today. But the ETS has definitely presented issues from both a health and safety side as well as an employment side. And I have been working with clients along with my colleagues to strategize and figure out how to address those issues effectively.
All right, so what are we going to cover today? We're going to get into what is in the COVID-19 vaccination testing and face coverings emergency temporary standard, what's required, who's covered, and some of the nuanced issues within the rule, how to implement it, who pays for different types of testing, what type of testing is available, how do you define some of the key terms in your policies and under the emergency standard, and then the status of the legal challenges. So let's jump right in. I'm not going to spend a lot of time talking about how we got here, but just to give a little bit of a framework, a little bit of reference or context for this rule. The president announced on September 9th his new action plan for how basically through the balance of 2021, the administration planned to tackle COVID-19 and hopefully end the pandemic in the US. And it was a 6-pronged plan. And the first and principal element of that plan was to try to increase the percentage of vaccinated individuals in the United States through a variety of different ways. But one of those ways, and probably the dominant strategy under the president's plan for getting the nation vaccinated, was through another COVID-19 emergency temporary standard issued by OSHA. So let's jump right into to the timing of that real quickly. What followed that September 9th announcement? OSHA moved fast, and not just fast for OSHA, but actually fast. They put together, without even knowing this was coming. We understand that the folks at OSHA did not know really much at all before the president's September 9th announcement that he was going to direct them to write another rule. But roughly a month later, they had delivered to OMB a proposed final emergency temporary standard. While that rule was at the White House's Office of Management and Budget, a couple of interesting things happened. One was OSHA got its first Senate-approved head of OSHA. It's the Obama administration. President Trump went 4 full years without a head of OSHA, and one has now been installed by President Biden. And that individual, Doug Parker, has been most recently the head of Cal OSHA, and as the head of Cal OSHA, has been the senior leader that marshaled in Cal OSHA's onerous COVID-19 emergency temporary standard. So his fingerprints, I think, are in the mix here and felt in this rulemaking as well. The White House's Office of Management and Budget held or scheduled at least 130 stakeholder meetings, and for an emergency rule, for any OSHA rule, that was extraordinary. And I do think that they heard and listened to and modified the rule before it was finalized based on some of the feedback they were hearing there. They concluded their review and issued the emergency temporary standard officially on Friday. We all got a glimpse of it on Thursday, November 4th, last Thursday. But on Friday the 5th, it was published in the Federal Register and became immediately effective. However, as we'll talk about today, much of the elements of the rule will phase in over time. And that's sort of when all hell broke loose. Once the rule was published in the Federal Register, we saw lots of things begin. There is a notice and comment period for the potentiality that this becomes a permanent rule, but also for the possibility of convincing OSHA to amend the current emergency rule. Legal challenges were filed all over the country. We'll get into some detailed discussion about that at the end. And in one of those challenges in the Fifth Circuit in Texas, the ETS was temporarily administratively stayed pending further action by the Fifth Circuit. So we're going to get into what does all that mean and what is the status of the rule. But for now, let's talk about what's in the rule. And on the next slide, we'll get into, this is basically a table of contents. I've got a separate slide essentially for each of these, which we consider to be the new requirements, the new actions or prohibitions that employers are required to implement to be in compliance with OSHA's new COVID-19 emergency temporary standard. And let's just go through these on the separate slides, starting with the next slide. The first two are essentially new paid time or sick leave benefits or requirements for employers to provide to employees. And it's for 2 different aspects of vaccination. The first requirement is a capped 4-hour paid time off benefit for employees to get vaccinated. And that's 4 hours per dose to get vaccinated. This applies only prospectively, not retroactively. So any of your employees who are already vaccinated before the effective date or before the implementation date of this PTO requirement, there is not a requirement for you to provide paid time or to provide some retroactive paid benefit. This is for employees getting vaccinated after the effective date of the ETS. There is this requirement for employers to provide 4 hours of PTO per dose. It only applies to what they're calling the primary vaccination, which means for Johnson & Johnson, a single dose. For Pfizer or Moderna, it is the 2 doses for that to become fully vaccinated. It does not apply to booster shots, regardless of whether an employee meets whatever criteria has been approved for booster shots by the CDC. This is only for getting to that initial stage of being considered fully vaccinated. It also applies only to vaccinations received during working hours. Now, you might have employee relations issues, or you might benefit and prefer to provide the benefit for employees who would decide to get vaccinated over the weekend or on a day that they're not scheduled to work. But technically, the idea here is you are required to grant employees a request for time off during their working hours to get vaccinated and to pay them for up to 4 hours of that time, however much time it actually takes, up to 4 hours. It includes only coverage for time, though. This is not about, gas, gas money, mileage, train or bus fare. It's about time spent getting vaccinated, but it includes all manner of time related to getting vaccinated. That includes time making the appointment, completing any necessary paperwork associated with it, traveling to and from the vaccine site, waiting to get vaccinated while you're at the vaccine site. And then if you've got to sit around for some time afterwards to make sure you don't have an allergic reaction, that time would be covered as well. So another important element of this PTO aspect is that you as the employer are not allowed to offset this PTO against any other accrued leave, accrued paid time benefit that you already provide, unless, of course, you have just set up prior to implementation of this rule a getting vaccinated paid time benefit, but you can't make an employee use sick leave or flexible PTO towards this particular PTO requirement in the ETS. This is a new bucket of leave that all employees covered by the rule are entitled to. On the next slide, we talk about a different form of paid time for employees that is created by the ETS. It is first a requirement to provide reasonable time off to employees to recover from the ill effects of the vaccine. And that's generally those sort of feeling sluggish, feeling fluish, up to more severe adverse outcomes as well. So it's provide reasonable time off and provide paid sick leave for this recovery time. Now, there's some similarities and some nuances between this paid sick leave for recovery time and the PTO for getting vaccinated. Both are prospective only. They only apply to vaccinations received after the emergency standard went into effect. They don't apply to booster shots, although we encourage booster shots for folks who are eligible. There is not a requirement for PTO getting vaccinated or a requirement for paid sick leave recovering from anything beyond that principal vaccination dose or doses. The rule here relative to recovery time also allows employers to set a cap, but it doesn't say what the cap has to be. It just says the cap has to be reasonable. And if you look at OSHA's guidance in the preamble that was issued in parallel with the rule, it says that OSHA presumes, based on CDC data about the typical side effects of the vaccine, OSHA presumes that if an employer makes available up to 2 days of paid sick leave, that would be compliant. Now, this whole thing is written really as a cop-out. I think OSHA would love for you all to provide 2 days of paid sick leave for employees in these circumstances, but that's more than most jurisdictions have set. There are some jurisdictions out there that have a paid sick leave requirement for recovering from the vaccine, but I've not seen any that provide more than one work shift. It's 8 hours or 1 day of paid recovery time for the vaccine. So since this is setting a reasonableness standard, And despite OSHA's reference to 2 days here, I think most employers would generally be in a comfortable place from regulatory risk standpoint if they set a 1 day or 8 hour or 1 work shift paid sick leave policy based on the lack of definition around that in the rule and the landscape of other jurisdictions that have done this. If you want to be perfectly safe doing something that OSHA would accept, 2 days seems to be the mark, but I don't think that there's a lot of regulatory risk if that was set at 1 day either.
Eric, this is Kate, if I could just add one point in here, and this is on the slide, but just to clarify, OSHA's position is 2 days of paid sick leave per dose would be reasonable. And what Eric is saying is we think that based on the data and other jurisdictions that have already set caps that employers don't have to go beyond, that 1 day per dose would be a reasonable amount of time.
Yeah, that's exactly right. It's per dose for both of these new sort of paid leave requirements. It is a per dose concept. One really significant difference, though, between this paid sick leave for recovery time versus the PTO to get vaccinated is that employers are allowed for this paid sick leave to require an employee to first consume other existing accrued but not yet used sick leave or generic flexible leave. However, if you have sort of specific buckets for different types of leave, it is only sick leave that you are allowed to require an employee to consume first for this purpose. You can't make an employee use vacation time or some other specific purpose designated leave for this purpose. And you also can't make an employee go into the hole, use future sick leave first. It's for accrued, not yet used sick leave or generic flexible leave you can require employees to use that first. The next requirement of the 8 core requirements of the ETS is a written policy. And this is just sort of classic OSHA. They can't create a rule or a regulation without having to make you create a new written policy to add to your book and binder of safety policies. So this is a requirement in the rule that you are to develop a written policy that identifies how you are going to implement the elements of the rule. So, and the elements of the rule, the things that we're talking about right now, but at its core it's some form of vaccination requirement, and we'll talk about the details here, whether it's a hard vaccine mandate, a vaccination and testing, test out option type of program, what your requirements are around evaluating vaccination status and documenting vaccination status, what your leave policies are going to be, what cap you set for those 2 sick leave or paid time benefits that we just talked about. All of that should be memorialized in your written vaccination testing and face covering policy. And then on the testing side, if you are going to provide the soft vaccine mandate and allow a testing out option, the policy needs to lay all that out. What tests you are going to consider to be acceptable, how testing is going to be conducted, who's going to conduct it, who's going to pay for it. We'll talk about how the standard doesn't require employers to pay for this, but many may decide that's the most practical way to do this, but your policy needs to lay that out and how that's going to be handled and how you're going to manage verifying test results. That all needs to be in your written vaccination testing and face coverings policy. And then finally, the 2 other major elements of the written policy are how you're going to manage employee notifications of a COVID positive diagnosis, a positive test, or a healthcare professional diagnosis, and what your isolation and return to work criteria are going to be. And then finally, face coverings. This rule creates a face covering requirement, at least for non-vaccinated workers. And so you need to spell out in your policy what your requirements are, how you're going to implement this face covering requirement, what face coverings you're expecting employees to use, whether and who is going to provide those, issues with when employees are required to wear them and when they're allowed not to, whether you intend this to apply to both vaccinated or unvaccinated and vaccinated employees or not. And we'll talk about what your options are there as we move through the rest of the slide deck. Let's move on to the next items 4 and 5 we'll talk about together. And this is the real guts of this rule. This is what the president announced on September 9th. This rule was going to be is a soft vaccine mandate rule. And OSHA wrote it in a really interesting way. They basically said employers are required to implement a hard vaccine mandate. Vaccination is the only option. But as an exception to that hard mandate requirement is anyone who doesn't want to do a hard mandate requirement. So they made it look almost like it was going to be a hard vaccine mandate, but then carved out any employer who wants to implement a soft vaccine mandate, a vaccination or testing option. The reason why they did that, interestingly, is first, they wanted to make it very clear that employers were allowed to implement a hard vaccine mandate if they want to. And they wanted it to be clear that if they wrote it as a soft vaccine mandate rule, there wouldn't be any interpretation or any argument that prohibited employers from requiring vaccination without a test out option. That's one reason. The other reason I think is they did it that way is they wanted to strengthen the argument that this regulation preempts conflicting or competing state laws and executive orders that would intend to bar hard vaccine mandates or to bar the collection of vaccination status information from employees. They wrote it principally as a hard mandate rule with exceptions so that it would more directly conflict with those laws and so that the supremacy clause of the Constitution argument for preemption by this federal rule would be a stronger argument. And that's why I think they did that. So this is a soft vaccine mandate, which requires, and we'll talk about the dates, but it's in January, for an employee to be permitted to report to work, the employee has to have shown proof that they are fully vaccinated or proof of a negative COVID-19 test within a week of that appearance at work. So in other words, weekly COVID testing or proof of full vaccination. And we'll get into all the nuances about what documentation is required and how all this is intended to work. Something that was a little bit of a surprise. It was not part of the president's announcement, but it really, we started to hear about it before the rule issued, and that is that it's really the proof of vaccination or testing and masks. And so for unvaccinated employees, they are required to have proof of a negative test and wear a face covering at all times when they are indoors or in a vehicle for work, except when they are, and these are the usual exceptions we've seen under CDC guidance, alone in a room, but OSHA is very explicit here that alone in a room means floor to ceiling walls and a closed door. So cubicles are not likely to be covered by this situation. And then those brief periods of time where an employee is eating or drinking, and for other items that you can see here on the slide. But the gist of it is universal, mandatory face coverings for unvaccinated workers while they are indoors at work. And there's not a social distancing element to this. There's not a decontamination element to this. There's not a ventilation element to this. It's proof of full vaccination or testing and face coverings. The interesting thing about this element of this standard that says if you are unvaccinated, you have to wear a mask is that I think the reading of that means if you are vaccinated, you are not required to wear a mask. And right now we have a situation where the CDC guidance and the current OSHA guidance says if you're fully vaccinated, you should still be wearing a mask indoors if you are in a community, a county that has higher substantial rates of transmission. And that continues to be today almost every county in the country. So technically, if you are complying with CDC guidance or OSHA guidance, everybody's in a face covering. But now we have a specific regulation. A specific regulation, a specific OSHA regulation generally preempts or bars OSHA from using the general duty clause to issue citations for subjects that are the subject of a specific regulation. So my reading of this is that at least as of December 5th, when the mask requirement for unvaccinated workers kicks in, that vaccinated workers, regardless of the level of community transmission, that employers may implement a policy that allows vaccinated workers, regardless of the level of community transmission, to drop their mask. And my view of this is that there shouldn't be meaningful regulatory risk in implementing a policy like that because of the way this regulation is written. So that's an interesting issue to consider, and I'm happy to talk through with you all how you implement mask policies going forward. And if my colleagues have some of their own thoughts to share, I welcome that.
This is Kate. Just one quick thing, and that is, if any of you out there have already established a masking policy and it's working, we're not saying that this means you have to change. What we're saying is this means you're allowed to change. As of December 5th, you would be allowed, we think, to change your policy by narrowing it to cover now from December 5th forward only those employees who are unvaccinated. But if you don't want to create the dichotomy in the workplace, you certainly would be allowed to continue the full masking for all employees policy.
That's right.
If you have one.
And then, of course, right, I think OSHA would take great issue with any employer that prohibits someone from wearing a mask voluntarily. And that's, in fact, covered by this rule. So voluntary mask wearing, even voluntary respirator use is mandated by this rule. So this just creates an option for you. Moving on to the sixth element of the ETS, and that is hopefully something that's already been happening for months and months now, and that is that employers are requiring employees to notify the employer if they have a COVID positive case. If they test positive or they get a diagnosis from a healthcare professional, there's a requirement to notify the employer. And then hand in hand with that is the employer's obligation to isolate that employee, remove that employee from the workplace, and keep that employee out of the workplace until return to work criteria are met. And the OSHA in this ETS lays out that return to work criteria. It is the current CDC recommended return to work criteria. And I'm not going to get into the details. You've probably seen it. There's a little bit, you can kind of see it on this slide, but the gist of it is it's the 10 days from symptom onset or from the positive test for asymptomatic cases. Nuances built in, but the idea is that you are building into your written policy and implementing a isolation and return to work criteria for COVID positive cases. The nice thing, OSHA spells this out in its guidance, that unlike the PTO requirement for getting vaccinated and the sick leave, paid sick leave requirement for recovery time, this requirement to have employees out of work for up to 10 days, or could potentially more, but for at least 10 days, does not create a new PTO requirement unless you are in a state or a county that has some other local, more stringent requirement that does require this time to be paid, or you have a term from collective bargaining in a CBA or otherwise that requires you to provide that as PTO. This rule does not create a separate PTO requirement for isolation and quarantine. The seventh core requirement of the emergency standard is to provide certain information to employees. And we didn't write it that way just to be wordy, as lawyers sometimes are. We are trying to distinguish, importantly, that this is not a training requirement. This is a provide information requirement, which is a big deal because you can achieve a compliance with this requirement by any method that you might otherwise communicate information to employees, including a mass email, some sort of posting in an intranet site, with links to different kinds of information, printing out hard copies of information and putting it on bulletin boards, discussing the subjects at a meeting or at a training event. Any of that is fair game for how you comply with the provide information to employees element of the ETS. The specific information you're required to provide is the requirements of the ETS and the employer's policy, whatever your policy is, to implement it. So I think, sharing a copy of your new vaccination, testing, and face coverings policy would achieve that. Maybe including a link to the OSHA rule would achieve the first piece of that in some sort of mass email or intranet posting. The third element that you're required to share with employees, specific CDC fact sheet about the efficacy and safety of the COVID-19 vaccine and the benefits of getting vaccinated. And there's a link to it here and, sort of a picture of it there. You could include a link to that CDC fact sheet in that mass email or posting at the workplace, or print out that fact sheet and post it there at the workplace. The other two pieces of information are quite interesting that you're required to share. One is you're required to share a reference to a criminal code provision that lays out criminal penalties for individuals knowingly supplying false statements and false documents. And I think the intent here is to scare employees against what we all are hearing about and reading about, is showing up with that fake white vaccine card that spells Pfizer wrong, that there's a criminal penalty available for individuals that would, for demonstrating compliance with a regulation, knowingly supply a falsified document. And this would apply, of course, also to employers. If you are an employer and you know that you have a counterfeit vaccine card or a fake vaccination record or a fake test result record, and you produce that to OSHA knowingly, there's criminal penalties for that. But the idea here is to make that known to employees, hopefully to discourage fraud in this area. Final element that you're required to share information about is the anti-retaliation requirements of the OSHA Act, that employees should know and understand that they are free to exercise protected safety actions without retaliation from their employer. I think that everyone has accomplished this by posting the OSHA in the workplace, but you might want to include a link to some exposition of the anti-retaliation elements in your mass communication about this. On the next slide, we get to the final element of the rule. The final thing that has really changed in a meaningful way in this rule is reporting requirements to OSHA. This is not record keeping, but reporting, picking up the phone and calling OSHA when you have a work-related illness that results in hospitalization or death. The reason why OSHA has added this element to the ETS is that as a generic rule under OSHA's reporting requirements, there is a time limitation on cases that become reportable to OSHA. And that means that a case that results in a hospitalization, an inpatient hospitalization, is only reportable to OSHA if the employee is admitted to the hospital within 24 hours of the exposure that causes the illness and the hospitalization. And COVID just doesn't work that way. It is my understanding that there has not been a single case that anyone is aware of where there's been an exposure to the virus and within 24 hours, someone has been admitted to the inpatient service of the hospital. And as a result, up to this point in the pandemic, there really shouldn't have been any hospitalizations that needed to be reported to OSHA. And OSHA knows that, and they're trying to address that by this ETS. Similarly, employees who succumb to the illness, that's only reportable to OSHA if the employee dies from COVID and it's work-related, and the death occurs within 30 days of the exposure that caused the illness and caused the death. And there have been plenty of cases. It's not as exhaustive as the hospitalization issue, but quite a few, I would say probably 20-25% that I've seen where it was more than 30 days after the last day at work or after the last known exposure that the employee succumbs to the illness, that would not be reportable to OSHA. So under this rule, OSHA has eliminated those 2 time restrictions and said that work-related cases that occur that result in an inpatient hospitalization or a death are reportable no matter how long it takes for those outcomes to occur. What does not happen with this rule is it does not adjust record-keeping requirements at all. And so I've seen a few questions popping up on the side here I wanted to address. Right now, thinking about vaccination in particular, adverse effects of the vaccine that require an employee to take days away from work. OSHA issued some guidance earlier this year that first said if an employee, if an employer mandates the vaccine and an employee experiences an adverse effect from that vaccine and it requires days away or work restriction or whatever, that would be recordable because it would be work related because you've required the vaccination. Everybody went nuts when they did that and said, that's terrible. You're going to create this disincentive. Why are we going to mandate the vaccine if you're going to wreck our DART rate by doing so? And so OSHA pulled back that guidance and issued new guidance that said, you're right. We want to encourage employers to get involved in vaccination. We want to encourage everyone to get vaccinated and make it as easy as possible and to remove all barriers and disincentives. So we are going to issue guidance that says, no matter the employer's involvement in the vaccination, whether it's mandated, whether it's an on-site clinic that you host, whether the employer is the vaccinator themselves, then it doesn't matter. Adverse reactions to the vaccine, no matter what, are not recordable on your 300 log. That has not changed. That has not been revisited. This rule doesn't say anything one way or the other about that. That FAQ, that's the form that it takes, is still sitting up on OSHA's website. And that is our understanding that right now, even if you opted for the hard mandate or a soft mandate with an on-site clinic with a really valuable incentive that gets employees to get vaccinated, not recordable, no matter what. That's our view on the adverse reactions to the vaccine. Of course, COVID cases can still be recordable if they're work-related, and OSHA's guidance on work-relatedness hasn't changed very much. It has taken new forms and it's gotten narrow, using fewer examples, but our view is that that guidance is still the same. There is a more likely than not analysis, but there's also a carve out for credible, known, alternative, non-work explanations. So if you've got those close call, tricky work-relatedness issues, don't hesitate to reach out and ask us about it. One last thing I'll say before I hand things over to my colleagues to get into the real weeds of this rule is about the written policy. And that's one of the things we've been working hard on at Kahn Carey, is developing a bunch of really good templates for this. If you want a hard mandate, here's a policy for that. If you want a soft mandate, if you want to do testing in this form or that form. And what we're basically doing is setting ourselves up to be able to help you implement a custom policy for you. So we're developing questionnaires and ideas to help you make the important decisions that have to be made for how you're going to comply. And then based on those answers, we can deliver to you a compliant written policy. So if that's something you're interested in, please reach out to us afterwards, and we're happy to work with you to do that. Sort of a flat fee, very efficient process. And that's something we've been working on since the president's since the rule was revealed last Thursday. So we'd love to help.
Thanks, Eric. So let me start talking about the compliance deadline. As many of you may know, this, and as Eric said, this rule was released and issued in the Federal Register last Friday, November 5th. And basically every requirement that is in the standard has a compliance deadline of December 5th, except for the testing mandate, the mandate to begin to test those folks or get a verification that those employees of yours who are not fully vaccinated have been tested. That obligation does not kick in until shortly after the new year. We are absolutely certain that OSHA set that date as a post New Year, 2022 date instead of before Christmas and the holiday season, because of the impossibility of getting something like that up and running in that short a time. There's a lot to do between now and December 5th, but the testing in particular is going to take a lot of time to figure out what kind of tests are you going to require. Are you guys going to, as OSHA allows under the standard, require your employees to test and pay for the test, or are you going to facilitate that testing because you want to not lose you want to lose as few employees as possible, so you're going to facilitate testing by arranging with local health department, with an outside vendor, etc. So that obligation starts January 4th. Now, all of this, by the way, is subject to what happens in the courts, as Eric mentioned, and we're going to talk about towards the end of this webinar. This standard is already under challenge in multiple venues across the nation, and at least one court, the Fifth Circuit, has issued this stay, the scope of which is uncertain, but we'll talk about that later. Anyway, let's move on, Teresa, to the next slide. All right, who is covered? I saw a lot of questions, or a number of questions anyway, coming in the chat box on this question of who is covered by the standard. So let's talk that through. The standard cuts out, obviously quite intentionally, small business. Employers who have 100 or more employees are covered in essentially all of the industries, except for what I'm going to talk about in a couple of minutes, across the nation, all general industry. The big trick here is, how do you do the count? The employee count, this was the big question, and OSHA has clearly answered it in the most broad way it can be answered, which is to say that you count the employees on a company-wide as opposed to a facility basis. So if your company has 13 facilities, all of whom have less than 100 employees at them, but total company-wide, you have more than 100 employees, you are in and have to cover all of those employees, but for what we talk about here, under this ETS. So of the types of employees that you have, who is covered? Obviously full-time, employees are covered, and that will be the bulk of it, but also part-time employees are covered. Seasonal employees are covered, and all other employees that are hired directly by you as opposed to by a staffing agency, regardless of where they are located. That is, if you have an employee, a direct employee, who has been working from home and will continue to work from home, like all of us who are sitting in our living rooms and offices and dining rooms at home, we've been teleworking since the pandemic. That does not mean that we're not covered. We are employees of our law firm, and therefore we are covered. So those people, teleworkers, are covered for purposes of the count. Okay, we're going to distinguish what the difference between whether you count those people for purposes of knowing if you're covered or not by the CTS, but then we're going to talk separately about whether this standard itself applies to those folks, meaning you have to get a weekly test or verify that they're vaccinated. Outdoors folks, people who work outdoors all the time, same thing. Those people are counted for purposes of determining whether you have 100. So if you're a construction company and you employ people who are doing work full-time outside, you count them. But in a minute, we're going to talk about the fact that they might not end up being covered by this standard. Interestingly, the standard, and it could have been written differently, but the standard does not cover temporary employees who you retain from a staffing agency or independent contractors with whom you have an independent contractor contract relationship. They do not get counted. Interestingly, for purposes of record keeping and reporting, OSHA does cover some temp employees if you have day-to-day management of those employees, but that is not what OSHA has done here. So they have done a full carve out for temporary employees in terms of your 100-person coverage. Each employer on multi-employer work sites is responsible for counting only their employees for ETS coverage. Okay, so you don't have to worry, you don't have to go through OSHA's multi-employer policy. You may have liability or responsibility or exposure under that policy for other workers than your own, but you do not have to count them for this ETS. The employee count is based on the number of employees as of the effective date of the standard. The effective date of the standard was last Friday, November 5th, okay? Or any date thereafter when your full company employee count hits 100. So the way this works is, it's pretty broad. Look at where you were on November 5th. If you had over 100 employees, you're in, and it does not matter from that point whether you get rid of employees, shed employees, you know, do a RIF, whatever. If you get under 100, it doesn't matter. You're in, and you're in full-time all the way through the expiration of this ETS. Same with if you are close but not at 100 last November 5th, but you know the holiday season is coming up and you're staffing up, you're a retail organization and you want to, you know, have more service reps in your facilities, you get over 100, you now from that point forward are in and you can't get out again. So post-holiday season, if this rule is still in effect, you are still in, again, to the duration of the standard until it expires, presumably 6 months from when it was promulgated, which would take us to May 4th. All right. Sticking with this topic of, you know, who's covered. As I said, we said independent contractors are not covered. Now, when you get into situations that are a little more complex, like franchisor-franchisee relationships, or you know, a corporate management company with various different independent corporate entities below it, let's talk about that situation for a minute. Independently owned and operated franchises are separate entities, and those franchises count only those individual franchise, you know, the individual Burger King counts only the employees at their individual franchise for purposes of making the threshold 100-person count. However, if you are a corporate entity and you have a management company, the parent company manages a series of subsidiaries that are independently incorporated, OSHA has given us some fairly confusing guidance that we're going to try to sort through and sort out in terms of Q&As or further guidance that OSHA will issue. But what they have said to date is, in a situation like that, if there is essentially a management company that is making decisions for and handling safety matters for all of those subsidiary independent corporate entities, the number of employees at all those independent corporate entities may need to be added to the corporate employees, the parent company employees, to figure out whether you hit that threshold. That is a big deal, and we are trying to sort through that. But right now, until we get further guidance, we have to look at how you are managing your independent corporate entities below and or sister entities to see, you know, whether OSHA would determine that under this ETS, they ought to be included in the threshold count to see if you're at 100. Interestingly, if you're regulated by the contractor hard mandate, I'm sure you all know that in addition to this, what we're calling the soft mandate or the vaccine testing face covering emergency standard, OSHA has also now issued hard mandates the federal government has issued hard mandates for other industries and or other entities. Federal contractors are under a hard mandate and will be required by January 4th to ensure that all their employees are vaccinated. They're not going to have the testing option. Per the Safe Federal Workforce Task Force, which is managing that contractor requirement, the way it reads is if you have either one control or power to control others, other entities, or a third party controlling all of these other entities, then that is indicia of control, which, kind of like piercing the corporate veil, corporate analyses has to be considered in making a determination about this threshold count. And I'm probably confusing the issue. Many of you on the phone probably don't have to deal with that, but I know some of you do. So for those of you who are looking at that question, maybe contact us directly and we can talk through your individual circumstance and situation. All right, who's not covered by the ETS? There are, as I just sort of mentioned, even though you have to count some people for purposes of determining whether you hit the 100th threshold, there are certain types of workers and workplaces that are not covered by this ETS at all. For instance, workplaces covered by OSHA's ETS for healthcare, the ETS that was issued June 21st and is still in effect, presumably will be in effect, but expire towards the end of December, right before Christmas. Those entities covered by the healthcare ETS are excluded, expressly excluded from coverage under this soft mandate ETS. Similarly, as I just said, workplaces covered by the hard mandate, the federal contractor hard mandate, are excluded from this ETS. So if you are a federal contractor and you are covered by that mandate, you do not have to work, you are not covered by this ETS. Now, there are a lot of questions about within the federal contractor entity, which employees are covered and which are not, and if there are certain segments that are not covered, are they covered by this? Again, probably too deep a dive to get into on this webinar, but please reach out to us and we'll sort through that with you. I mentioned this already. Employees who don't report to a workplace where other individuals are present. The most obvious example are teleworkers. Those entities count for purposes of determining whether you're in the ETS, but you do not have to ensure that they are vaccinated. You do not have to get a weekly test for them. They are not covered by this standard. You don't have to provide the information that OSHA requires. You don't have to, they are not under the policy that you're going to develop by December 5th. Employees who work from home, like I just said, employees who are in a truck, who are not reporting to a workplace where other workers are present. I think we have a separate slide on working in a vehicle, so I'll save that for next. Employees who work outdoors. Now, I think we've got a slide on that, but just basically, if you are full-time, essentially full-time outdoors, this particular employee is outdoor all the work, he shows up, he clocks in, briefly walks into the building to punch the clock, then walks out, is outside the whole time, and walks back in to punch the clock to leave. That's someone who is not covered. However, if that worker spends a fair amount of time inside and outside, even if there's a pretty substantial, let's say 75% of the time they're outdoors doing work, if they're 25% inside, OSHA would say that worker is covered and you have to make sure they're vaccinated or they have to test. Next slide. So here's more on the worker outdoor exemption. Yeah, you have to work outdoors every day. Some days if you're inside, some days if you're outside, that does not count. It's really got to be virtually all the time. Employees who share communal indoor workspaces as part of their work duties. For instance, if they drive to work together in a company vehicle, not their own personal vehicle, a commute, but if they drive in a company vehicle, they're not accepted. And, so you're going to have to do sort of a deep dive in doing an analysis on those folks of yours that are working outside. If there's, a multi-stalled bathroom or administrative office, what you're going to have to do is make sure that the stay inside is really brief. You're probably going to want to put some guidelines and guardrails around that in order to exclude them from coverage of this ETS. Buildings under construction. If the building is, for the most part, open to the outdoor air space, that is, sorry, I just lost my slide here. that is, substantial portions are not closed in, then then the workers who are working in that area are not covered by the ETS. But once that building, gets walls and a ceiling and it is confined or enclosed, those folks actually then become covered by the ETS. Next slide. Okay, who pays for testing? I think Lindsay is going to take over here. Lindsay, do you want to start talking about this topic?
Sure, thanks, Kate. And just to reiterate, I know we are getting a lot of questions coming in, and hopefully some of them have been addressed or will be addressed in the upcoming slides. But to the extent that they're not, we are going to review the questions afterwards as well. It looks like we might not really have time maybe during the session to answer a lot of questions, but if there are remaining questions, we can definitely follow up with people individually as well on those questions. The next several slides are sort of discrete aspects of the ETS that we wanted to make sure and address. I know we're already sort of up against an hour at this point, so I'll try to get through the next several promptly, but we do want to make sure that we cover some important issues related to these topics as well. Teresa, can you go back to the who pays for testing slide? Thank you. So who pays for testing? OSHA says explicitly in the ETS that it does not require the employer to pay for any costs associated with testing. This is something that we definitely advocated for prior to the rule coming out. This was something that I know was a big issue for a lot of employers. We wanted to see that, OSHA was not going to at least require that employers pay for costs associated with testing. However, there is an exception in the rule that says that testing may be required to be covered by employers where other laws, regulations, or collective bargaining agreements require it. And this is significant because we're seeing a couple different areas where this can come into play. One of the areas that we've been evaluating is there are certain states that have laws already in place, completely unrelated to COVID, specifically in most cases, if not all cases, but that have laws in place that say that employers are prohibited from requiring employees to cover costs associated with medical examinations and testing. So in states that have laws like this, and that includes California, New Jersey, Kentucky, and several other states, we might see in those states that employers would still have to cover the cost, even though the federal ETS does not require this. If the state law prohibits an employer from passing on the cost, then they might still be responsible under the state law to pay for costs associated with testing. Another area where we're seeing that the cost burden might shift is where you have a reasonable accommodation request. Generally, employers are responsible for paying for whatever reasonable accommodation they put in place. So where employees are requesting an accommodation to vaccination, for example, and that could be, either based on a disability under the Americans with Disabilities Act or for religious accommodation under Title VII, where the employee is asking for an accommodation from vaccination, and testing is determined to be the reasonable accommodation given to that employee. In that case, it is most likely that the employer would be responsible for paying for the costs associated with testing. And, I won't spend too much time right now just because, we do have quite a few things still to cover, but there is, related to assessing a reasonable accommodation, there is this standard called undue hardship that could make a reasonable accommodation impossible to give to an employee in that case. Under Title VII, it is a lower bar. It's a de minimis cost. So costs associated with testing might be an undue hardship on an employer, but that is an individualized assessment that an employer would have to do related to each request for an accommodation. And then finally, related to collective bargaining agreements, there could be provisions already in a collective bargaining agreement, or there might be, as as the ETS is being implemented and there are negotiations over aspects of this that need to be included in a collective bargaining agreement, a union could certainly push for some or all of the costs of testing to be covered if it's not already addressed in some way, shape, or form in a collective bargaining agreement. And then finally, the ETS does not prohibit employers from paying costs. OSHA says explicitly, if an employer wants to take on the cost of testing, they can do so. But the intent was to shift the cost burden to employees in this case, though the exception may make that not possible for some employers. Next slide. Another discrete issue that is addressed by the ETS is the definition of fully vaccinated. We were not surprised to see the definition included in the ETS. It is consistent with the CDC's definition as of September 16th, 2021. And basically, there are sort of two major components of the definition of fully vaccinated. First, that the individual has had either single or both doses of whatever vaccine they decide to get within the required interval. So there's a certain amount of days for Moderna, there's a certain amount of days for Pfizer in between the two doses. So they have to have had all the required doses, whether that's single or double, and then at the correct interval. And then the second piece of that is that it has to have been 2 weeks since the final dose. So if they meet both of those criteria, then they would meet the definition of fully vaccinated under the ETS. And the ETS also specifies the types of vaccinations that are permissible, those that have been approved for emergency use by the FDA, listed for emergency use by the World Health Organization, and then also for individuals who are part of a clinical trial, if they did receive the active dose during that clinical trial, that would be sufficient to meet the definition of fully vaccinated. The definition also permits mixing of approved vaccines. So if the employee gets 1 dose of Pfizer and 1 dose of Moderna, that can be acceptable as long as they meet the other criteria, the time between the doses and that it's been 2 weeks since the final dose. And right now, the way that the ETS has defined fully vaccinated, it does not include a booster shot. So if the employee has had the single dose of Johnson & Johnson, or they've had 2 doses of Moderna or Pfizer, they do not need to have a booster shot now to be able to be considered fully vaccinated. Next slide. For face coverings, OSHA provided a broad sort of range of face coverings that would be acceptable under the ETS. They do have to meet certain requirements, and those requirements are provided on this slide. And they're requirements that we've seen sort of from the CDC for a while now. They need to fit snugly, have 2 or more layers of tightly woven, breathable fabric. They have to be solid, so there cannot be exhalation valves or any punctures, as this would not fully protect against the nature of COVID-19 transmission. Notably, they can include clear face coverings or cloth face coverings with a clear plastic panel, as long as it meets those other requirements provided here, so that if you do have employees who are deaf or hard of hearing, they're able to more effectively communicate with others. They can be homemade or manufactured, disposable or reusable. Like I said, really a broad range here. The ETS also makes clear that employers cannot prevent employees from voluntarily wearing a face covering or respirator in the workplace. So even if you have vaccinated employees who may not otherwise be required to wear a face covering, as of the effectiveness of the ETS, they could still voluntarily decide to do so, and the employer would be prohibited from not allowing them to do so. Similarly, an employer cannot bar customers or visitors from voluntarily wearing face coverings in their facilities as well. And like the testing, OSHA has said that employer is not required to pay any of the costs associated with face coverings. That is something that the employee can provide and choose the face covering they use as long as it meets the requirements set out in the standard. But again, there is that caveat unless the employer is required to pay for face coverings under other laws like state laws, potentially regulations or collective bargaining agreements. Next slide. So does the ETS recognize natural immunity? The answer here is generally no. The ETS did not carve out an exception to face coverings or to weekly testing for those with natural immunity, those who have already had COVID-19 and recovered from COVID-19. There's no blanket exemption for those in the ETS. But an employee who does have a confirmed case of COVID-19 does not have to undergo weekly testing for a period of 90 days after the confirmed test. So, when those 90 days are up, that individual would still have to be subject to weekly testing, but during that 90-day period right after a confirmed case of COVID-19, either through a positive test or diagnosis by a medical professional, during just that 90-day period, they would not have to undergo weekly testing. And in the standard, OSHA acknowledged, that this is certainly an evolving area, that we do not sort of know the full extent of, what natural immunity does. But at this point, there was not sufficient evidence that OSHA wanted to include or decided that it should include an exemption for natural immunity. Next slide. So this just briefly provides a summary of the types of testing that would be permitted under the ETS. I think an important point here is that the testing used to meet the weekly testing burden is limited to diagnostic testing. OSHA explicitly said that antibody testing is not sufficient to meet the obligations under this standard, so it has to be a form of diagnostic testing, but that does include antigen tests where the tests otherwise meet the requirements of a COVID-19 test as laid out in the ETS. So the top portion of this slide here just goes through the basic requirements for any test to be considered sufficient under the ETS. And then the next part sort of provides specific examples of different types of tests. Another, I think, important thing to note here, and something that we've definitely gotten questions on and is a concern for how this would actually work in practice, is for over-the-counter tests to be considered sufficient form of testing under the ETS. A test cannot be both self-administered and read. It has to be observed by a third party, specifically the employer can observe and proctor the test, or an authorized telehealth practitioner can observe and proctor the test. So an employee who does use an over-the-counter form of testing would need to take the test and read the test in front of either the employer or an authorized telehealth practitioner for that to be sufficient to meet the requirements of the ETS. And I think the motivation here was, again, Eric talked about this a little bit, but that concern about fraudulent results and OSHA wanting there to be an independent confirmation of the results when the test is taken. OSHA guidance also does explain that employers can use what's called pool testing, which is where the same type of specimen from several people is combined and laboratory tested to detect COVID-19. If pool testing is used, and OSHA identifies, this could be a way to potentially save on resources or costs associated with testing. If pool testing is used and the test comes back as negative, then it's considered that all specimens that were part of that test are negative, and that documentation of the negative result would be sufficient for those employees whose specimens were included with the pool testing. However, if it comes back positive, then there would need to be retesting done on individual specimens to determine which of those employees are coming back as positive for COVID-19. One related note here is that OSHA does address the situation where there is a testing shortage. Although the ETS does not specifically address it, in the guidance, OSHA says that it would exercise enforcement discretion where there is a testing shortage that makes individualized testing on a weekly basis not possible, where the employer is showing good faith efforts to meet the requirements of the ETS. And then conversely, related to that, if an employee is unable to provide the results, a negative result of their test through no fault of their own, from a legal perspective, we would recommend allowing them to use either paid or unpaid leave until they're able to get the results. And this is going to be sort of in a situation where an employee takes a test and for some reason, whether the lab is backed up or whatever the reason, they're not able to get their tests timely in order to be able to come back to the workplace. Next slide. And then the ETS also does provide specific documentation required to both the vaccination component as well as the testing component of the ETS. For vaccination, OSHA lays out acceptable proof of vaccination status, and this is sort of the starting point for what should be provided documentation-wise. This is the expectation for what an employer should obtain from an employee documentation-wise. And overall, it's going to be any official document that lists the type of vaccine, dates of vaccination, and ID of the healthcare professional or site that administered the vaccine. In a lot of cases, probably the easiest and go-to form of documentation would be the vaccination card. But if you have a case where an employee has lost their vaccination card or for some reason did not otherwise get a vaccination card, they can produce another official document like a medical record or record of immunization to show that they have in fact gotten fully vaccinated. Employers do have to maintain proof of documentation, so they have to get copies of this documentation and maintain that. That is something that could, OSHA could request and an employer would have to make available. Separately, employers also have to maintain a roster of each employee's vaccination status, and that roster has to include all employees and clearly indicate their vaccination status. So whether that's fully vaccinated, partially vaccinated, not vaccinated because of a medical or religious accommodation, or not fully vaccinated because they have not provided acceptable proof of their vaccination status. Next slide. So self-attestation, OSHA does also explicitly address this in the ETS. I know, a lot of employers were using this prior to the ETS coming out to support that an employee had gotten fully vaccinated. OSHA does not identify this as a form of acceptable proof of vaccination, but says that it would be permitted in certain limited circumstances where an employee for some reason cannot otherwise provide that, official documentation of their vaccination status. In the preamble to the rule, OSHA even talks about, that an employee should contact their vaccination provider to try to get a copy, or utilize their state health department to try to get documentation of their immunization before self-attestation is used. But where it is used, where it is required because the employee cannot provide any other documentation, it lays out specific requirements for that self-attestation form, including number 4, which kind of jumped out at me when I was reviewing the rule. And I think, this goes back to, again, Eric's point about the concern related to fraudulent documentation. The self-attestation form does have to include this specific language that says, regarding my vaccination status on this form may subject me to criminal penalties. So again, emphasizing this is another way that employees will have it emphasized to them that engaging in providing a fraudulent form is impermissible. And then a quick point on the grandfathering concept in the ETS. So the ETS does say that for those employers that collected vaccination status information prior to November 5th, 2021, that if they have documentation of vaccination status, then that can be sufficient, and they do not have to now ask for one of the forms of proof that is provided in the ETS. I think, an important thing to keep in mind here is that it is at least the preamble, the guidance in the preamble does sort of create this as a broad form of documentation. OSHA says if there was a circumstance where you had an employee who came in and verbally, said that they had completed their vaccination status, but there was no documentation of that at the time, then that is a case where the employer would now need to get some form of documentation. But if there is a form of documentation to show that the employee did get vaccinated, like emails that were retained by the employer, documentation that was uploaded through their portal, or if the employer created and retained some other means of documentation when it got the information from an employee, then that would be sufficient to meet the requirement and to be grandfathered in, so that additional forms of documentation would not be required now.
And
Next slide.
Lindsay, if I could just add one point here, that would include everyone, even if as an employer you kept a running list, that's a document that counts. So if prior to November 5th, you were asking every employee to report to you and you were keeping some document, electronic or otherwise, that checked off Kate McMahon, fully vaccinated, that's good enough. You don't have to go collect now these documents, as Lindsay said, that now from November 5th forward are necessary for purposes of documentation.
Yep, exactly. Yeah, I think OSHA, tried to sort of separate this idea of having any form of documentation from maybe the case where it was just a verbal communication and then no documentation was created. That wouldn't be acceptable. But otherwise, if there's documentation, like Kate said, that's going to be considered sufficient. All right, next slide. And then documenting test results. Again, OSHA lays out in the ETS specific things that have to be included in a record of testing. And these are the types of things that are generally going to be included in, documentation that an employee receives after they do complete a COVID-19 test. And we again reiterate here that employees cannot self-administer and self-report where over-the-counter methods are used. That does have to be proctored by either the employer or a telehealth provider. And there is a responsibility on the employer's part to verify the results, to ensure that the documentation provided is sufficient under the ETS. And then they have to maintain those records of the weekly testing, the results of the weekly testing for those unvaccinated employees. And that leads into the next slide, which is sort of our last slide on the substantive parts of the ETS, and that is the record preservation requirements. So just really briefly here, OSHA does say that the proof of vaccination, those vaccination status rosters, and the COVID-19 testing records are all considered employee medical records under 1910-1020, but they also explicitly state in the ETS that even though they are medical records under 1910-1020, that they are exempt from the normal retention period for medical records under that standard. So as many of you might know, 1910-1020 generally requires employers to maintain employee medical records for the tenure of employment plus 30 years, so a very long period of time. But the ETS exempts them from that requirement, and employers are only required to maintain those medical records, the proof of testing and vaccination and those vaccination status rosters for the time period that the ETS is in effect. And then a couple important notes related to that. Again, they are medical records, so they do have to be protected as confidential records, which means they should not be maintained in employee personnel files. They should be maintained separately from other personnel information. And then a vaccination roster is something that can be requested by OSHA. And if it is requested by OSHA, it has to be produced within 4 hours of a request. And then, like I said before, an employer also has to be able to provide proof of vaccination and testing to OSHA if requested, but they have a little bit longer period of time to organize that documentation. It has to be produced to OSHA by the end of the next business day. So with that, I will turn it back over to Kate to close us out on the status of the legal challenges.
All right, everyone. Well, I think we're going to be able to get you off here in an hour and a half, which is pretty amazing, I think, if we can meet that. So I'll try to spend the next 5 minutes or so giving you a status report that might mean that everything we just told you is irrelevant because the standard might not in the end see the light of day. However, I want to follow that very, very, very quickly by saying that is absolutely a complete uncertainty right now. We do not know. No one who says they know knows what is going to happen here. So let us tell you kind of what we do know about the status of the legal challenges and what we anticipate, at least in terms of timing of these challenges. And, we can give you some insight on some predictions, but there's no way to know right now how this is all going to sort out at the end of the day. Okay. First of all, I can't think of another standard that, certainly another OSHA standard that was challenged as broadly, as quickly as this ETS. You guys may remember back in June when the ETS came out that was a much broader in some way, ETS. Everyone thought there were going to be a lot of challenges because it applied only to the healthcare industry, even though it was broad in its requirements. It was narrow in terms of its scope. It really didn't get a lot of challenges. This one got a lot of challenges. The most amazing thing, I think, to share is not only was this standard challenged by employers and businesses, more than that even, it was challenged by state attorneys general. So various states, 26, I actually think the count might be 27 now, but 26 or 27 states have actually filed a lawsuit in a federal court challenging the authority of OSHA to issue this emergency temporary standard. Some of these challenges have been combined. So overall, there are 12 separate legal challenges, all of which they're not exactly the same, but they look very, very similar. The challengers, the petitioners, if you will, consist of, as I said, many states, more than half of the states in this country, along with a few individual businesses, some religious groups, some nonprofit organizations, some unions, some worker advocates, and some public health entities. So this is like Alice in Wonderland. The entities who, by and large, have not to date sued are big companies, although I believe that there may have been a lawsuit filed late last night in the Fifth Circuit that was a lawsuit that included some trade associations and large companies. I need to check on the status of that. In any case, right now, we've got challenges going in 6 circuits. The way rules, some of you may know this, the way an OSHA rule is challenged, you skip the district, you're challenged in federal court, but you skip the district court level and you go straight to the circuit courts. The circuit courts, not surprisingly, that have had challenges filed to date are the most conservative circuits in the nation. Certainly at least the 5th, 6th, 7th, 8th, and 11th. If you had to, if you had to bring a challenge to an agency action like OSHA's action here, you would file in those circuits. The interesting one to me is the DC Circuit challenge. It was actually filed by the RNC, the Republican National Committee, and the DC Circuit is not, I would not categorize it as a completely anti-rule circuit. So that one, that one confounds me. In any case, there they sit. On Saturday, they were all filed on, well, there have been a series of filings every day since the 5th, but a number of them were filed on the 5th, the very day the standard issued or became effective and was in the Federal Register. And on Saturday, one day later, the Fifth Circuit represents Texas, Louisiana, Mississippi, and is recognized as a pretty conservative circuit. The Fifth Circuit had a 3-judge panel rule on an application for a temporary emergency standard. It basically a stay of this rule, a halt, a pause of the rule until the merits of the challenge could be heard. And the circuit issued the stay. They stayed and stopped implementation of the standard pending a hearing on the merits. This is moving lightning speed compared to, even temporary emergency standards applications, which move pretty quickly. The court's reasoning, and it was like a 1-page, 2-sentence order that was issued, and we quoted in here the language that the circuit included. It said, because the petitions give cause to believe that there are grave statutory and constitutional issues with the ETS, it is hereby stayed pending further action of the court. Now, what happens next is, because all of these challenges have been filed in different circuits, parties have 60 days to file a challenge to a OSHA standard. However, the challenges that are filed in the first 10 days, basically those circuits where those challenges are filed get put into a lottery. There's a system that establishes how a circuit is chosen to actually hear all these challenges. They get consolidated in one court for purposes of, efficient use of judicial resources. And then that one circuit court will hear them. That one circuit court is chosen by lottery. It is not by experience. It is not by, standing up and saying, we want it. It is random and objective and by lottery. I expect before November 15th, which is the day that the 10-day period would run, November 15th or 16th, I expect there will be challenges filed in some of the more traditionally liberal courts, like the Ninth Circuit, for instance, where I expect there will be some challenges brought saying that the ETS is not strong enough, it's not broad enough, it should be a hard mandate, not a soft mandate. It should require KN90 or N95s, not just face masks, et cetera, challenging that aspect of the rule, really just so they can include a liberal court or a couple of liberal courts in this lottery with the hope that one of those courts gets chosen. And these are entities that would want to keep this ETS in place. I don't know, is there another slide on here or no? All right, the future of the legal challenges. We expect that this is going to move very quickly. The Fifth Circuit obviously has made a determination that, it looks like they want this case. We don't know that they'll get it because, as I said, this multi-district litigation lottery system will unfold. And by the 16th of November, the 11th day after this rule became effective, there will be all these things will be in this lottery system. And we think it'll be quite likely that that circuit court will be chosen and will be public within, a very short time. So we should know before Thanksgiving which circuit is going to hear these cases. If it remains in the Fifth Circuit, it does seem that there's a high likelihood, but it's not guaranteed, but there's at least a high likelihood that the circuit would hear the case on the merits in an expedited fashion and could certainly rule to shut down this and determine that this ETS is impermissible. On the other hand, if the DC Circuit, if the Ninth Circuit hears the case, it may go the opposite way. As I said, we just don't know. We do know that it will likely move pretty quickly. Whatever happens at the circuit court level, it is highly likely to end up at the Supreme Court in one of two ways. Either sort of the traditional way, where there'll be a determination on the TRO, which will be challenged to the Supreme Court. And the Supreme Court may hear an argument on the merits of the stay, and or, by doing so on the merits of the standard. The second way to get to the Supreme Court would be the shadow docket. There have been 3 applications filed to the circuit court so far associated with hard vaccine mandates that have been issued by states. All 3 of those filings were rejected by the Supreme Court. They sent them back to the circuit and said, you know what, it may end up here someday, but we're not gonna allow you to jump over the circuit. We'll see what happens there. The Supreme Court may at least hear the temporary stay issue, make a determination on the stay, and let this thing, the merits challenge, play out at the circuit court level. So that's what we know. One more and very important thing. What is the scope of the current stay? Right now, only one court has stayed this, and it's the Fifth Circuit. As I mentioned, the Fifth Circuit is Texas, Louisiana, Mississippi. Is the rule stayed in the rest of the nation? We know it stayed in those 3 states. And I'm sorry to say that it's quite unclear, believe it or not. The decision itself, you saw on this slide, the language that was a quote from the stay. It does not say, the circuit does not say in its stay order whether it is a nationwide stay or not. The petitioners, in their petition for review and their application for a stay, asked for a stay, quote, in the United States. So obviously they asked for a nationwide stay. Certainly there is precedent in the administrative context where there's an administrative rule that is challenged for nationwide stays. And in fact, the Fifth Circuit, there's precedent in the Fifth Circuit for the issuance of nationwide stays that have been upheld. However, the Supreme Court, over the last couple of years, in particular, the more conservative justices on the Supreme Court have raised real questions about whether circuit courts have injunctive relief authority that applies beyond their circuit. And they may be looking for a case to actually make that clear. So I cannot tell you for certain that this stay is nationwide or is limited to the Fifth Circuit. I can tell you that from our perspective, because there is such uncertainty surrounding this, and because of the timing of the rule and the compliance deadlines, that we think it makes sense to continue to act as if this is going to survive in some form or fashion. And I know that means expending some time, some resources, some energy, figuring out how you're going to put this program in place. But there's a pretty good likelihood that by December 5th, when you actually have to have programs in place, we're going to know something more about the survivability of this standard. And so, but what we want to avoid, or what we'd like to help you avoid, is finding out, if the courts hear this the week of Thanksgiving, finding out the week after Thanksgiving that yes, indeed, this thing has survived. And you then have to scramble because those dates may not move. You can't count on them being pushed back. Certainly, I think the parties will ask for a extension of those dates by the amount of time that this uncertainty has been in place, and whether the stay that has been in place presumably may apply nationwide. There'll be a request for an extension, but whether OSHA would grant that or not, I don't know. This administration is being really aggressive in trying to get the country vaccinated. It is clear that this administration is banking on the fact that if it does get us to herd immunity, if we do get enough people vaccinated, we will move out of the pandemic in this country. And they'll take the body blows and the political hits in the meantime, but if they can move us past the pandemic, they're, I think, banking on the fact that all will be forgotten and the economy will come roaring back and they'll look pretty good by the midterms. So I don't know that we're going to be able to count on a lot of extensions, even ones that, you know, would have a reasonable basis for the request. With that, I think we're going to close out. Thank you very much on behalf of my colleague, Eric Kahn, and my other colleague, Lindsay DeSalvo. We're all thrilled to be able to help you. We're sorry everyone's going through this. We hope that you can, you know, reach out to us and rely on us to get you answers very promptly. And that is our plan. Thank you very much. And we will talk to you soon.